Ease of use. So, as a doctor speaking to other doctors, let's just get to the chase. A lot of stuff we do is for our ease of use, right? So in the hospital, MPO is, I think, the best example. Many patients are made MPO after midnight, just in case they'll do it tomorrow. So first of all, sometimes people justify saying, "Well, it's a workflow, right? I know it'll hinder flow. Maybe the surgeon would have done it. They haven't evaluated it, but there's a possibility. You don't want to slow everything down." But then there's some things where simply the patient doesn't need to be MPO, like for a CT scan. Why are they MPO? And so you may say, well, just in case, but really, like, why are they MPO? And I think many times hospitalists or other people are not sure, and they just, out of an abundance of caution, to make the patient MPO. But that has nothing to do with the caution, right? It has everything to do with that they don't know, or they're too lazy, it's too difficult to look up to actually get the answer, blah, blah, blah. But let's go talk about ease of use. The real person it's addressing is the patient. And the question is, why don't we actually talk to patients about what is easy for them to do, what they can actually do? I remember going to a physical therapy appointment recently, and the guy kept asking me, what do you think you can do? What is reasonable for you? How much can you do? Which actually makes a lot of sense. So if you look at the rest of the world, which healthcare, I guess we're trying to pretend we're not the rest of the world. I mean, technology is very expensive, healthcare is very backwards, and it costs a lot more. And it doesn't work that well. Not like an Apple device, right? But the thing is, if you think about it, the rest of the world has gone to ease of use, right? Remember manuals? We had to read them to use a new app. It wasn't apps back then, a new program, this or that. Now, who does that? If you can't figure it out, then, nobody's going to use your app, right? And then there's a lot of other things like that, right? So, I know engineers, right? Because I was an engineer. I know many. A lot of times they think the user is stupid. And I agree. Many times the user is stupid. But there's not much you could do about that. You got to deal with the user who is stupid sometimes. And the thing is, with the rest of the world, they've realized that the user is sort of important. You got to figure out what they can do. If they can't do it, if they can't figure it out, then they're just going to be turning it or whatever, right? No good. There's no point if they're not going to do it. And yet, do we ever ask patients, how easy it is for you to do this? How easy is it for you to do that? Sometimes I ask, can you take a medication once a day, twice a day? Because apparently a lot of people cannot, right? Insulin. Many doctors feel a patient is obligated to be on insulin because their A1C is too high, like 10, 11, whatever. What if the patient is not willing to do insulin? Do you think you're going to accomplish anything when the person is not going to do it? I guess maybe give the drug company some money for the insulin they buy. Ease of use. We have to consider it, right? What can the patient do? Like, when's the last time you sat down with the patient? Hey, just tell me honestly. What can you actually do, right? If I do this or that, do you think you could do that? Do you think you could do that? Do you think you could take some medications? Do you think you could change your lifestyle? Do you think you could eat differently? Start exercising? What is reasonable for you? What do you think is possible? Because you don't want to infer, right? You don't want to impose your things. That seems simple enough, right? For me, the humbling message is that a lot of these things that seem really simple and easy, I actually don't do myself. Like physical therapy, yeah, the exercises, don't think I've even done a whole set of them in the past few weeks, right? The neck ones, I've been doing a little bit better, but, sort of forgotten the past few days. I just saw them last week. So I've probably had 2-3 good days. And I think that a lot of it, and the medications, like, do you know how hard it is to take medications 4 times a day? Like, most people, even my mom can't do it. They're like, why did they give these medications? Like, Keflex, it just has to be 4 times a day. Sometimes we dose it 3 times that higher dose, but just has to be so frequent. That's the way it works. Otherwise, it doesn't work so well. But really, people's lives are different, right? Some people eat breakfast, some people don't. That's just a silly example, but we should realize that people's lives are different. You don't know actually how they live life. I remember when I was in Zambia doing a rotation there, that one doctor was asking about patients, and this is kidney. He's like, how come they, this or that? How come they're always dehydrated coming in? I was like, I don't know, right? He's like, well, it's simple. So they're probably coming in from far away, and they probably left at 4 a.m. And the buses don't have bathrooms, and they have to transfer. So they don't want the hassle of having to use the bathroom. And so they're just not going to eat and drink for like yesterday and this morning. Solves that issue. Except that if you're a kidney doctor, you're sort of don't like these patients with borderline kidney function not drink for so long. But the whole point is he understands where they're coming from. And we don't, right? Many of us are just like a foreigner in Africa. We don't know how it works. And the reason I mentioned that is, do you know that there's more similarities between people in different countries from different cultural backgrounds, religions, whatever, who have similar amounts of money, the same socioeconomic class, than people within the same country who are different socioeconomic classes? Think about it. So, many of our patients don't have that much money, right? The doctor other times sort of offended me thinking, oh, I don't want this better version of a drop for medication for my daughter because it's $150 is not covered by insurance versus a $10 one. It's like, why wouldn't I buy the better one, right? I mean, we're used to thinking patients don't have money. And oftentimes it's true, actually. They don't have money. They can't just spend $600 a month on medications. They can't just say, yeah, you guys are taking too long to figure out how to cover this. Let me just give you my credit card and run it for $1,000, whatever. It's not a big deal. And the thing is, we're from different levels. Like, when's the last time you've seen your patients when you were eating out? I don't think you go to the same places. I remember medical school, I went with my, my roommate to Country Harvest, Hometown Buffet. They're all the same company. It's like, wow, we see our patients here. I mean, we don't often go to these places. It's where your chicken noodle soup is actually yellow. And they serve steak, and it's theoretically steak, and it's like a buffet that costs $20. You're like, the steak is probably not so great. But anyways, the thing is, we don't know our patients. We don't have the same lifestyle as our patients. And so wouldn't it behoove us just to ask, hey, is this easy for you? What is doable for you? Let me know. Let's figure out a plan together. Isn't that, obvious?